Welcome back to the AI-MCP Agent use case series. I'm George Snyder, one of the developers of the platform. Today we're in a clinic building a two-agent team for patient pre-visit intake, the kind of work that has to be both fast and extremely careful because it involves people's health and their private information. Here's the first agent, the pre-visit intake assistant. Its job is to take what a patient describes and record it properly. Two things make it safe to use in healthcare. First, look at the guardrail on it. Privacy protection is switched on and set to enforce, so private details like phone numbers and other identifiers are automatically redacted. The agent handles the patient's information, but that information is protected the whole way through. Second, it's connected to the clinic's medical record system with tools to confirm the patient and write an intake note. Its instructions tell it to record the note and then hand off a clean summary for triage. The second agent is the triage router, and this one carries no tools at all. Its value is judgment. It reads the intake summary and looks specifically for red flag symptoms: chest pain, shortness of breath, stroke signs, severe bleeding. Its rule is unambiguous. If any red flag is present, route the patient to immediate nurse triage and say so clearly. Otherwise, schedule a routine visit, and it must name the exact symptom that drove its decision, so a human can see its reasoning at a glance. Here's the team together in the multi-agent flow designer. Left to right, the flow starts, the intake agent records the visit and protects the private data, then hands off to the triage router, which makes the safety call and finishes. Two agents with very different jobs, one gathers, one decides, combined into one dependable pathway, built with the blocks in the palette and no code. The handoff between them is explicit. Click the intake agent and you'll see it outputs an intake summary. The chief complaint, the symptoms, the duration, the patient ID. Click the triage router and it declares that same intake summary as its input. So the clinical picture the first agent assembled flows cleanly into the safety decision the second agent makes with nothing lost along the way. Let's run a real call. A patient reporting chest pain and shortness of breath for the last hour. Watch the team. The intake agent confirms the patient and writes a clinical note. And notice the private contact number is redacted by the guardrail. Then it hands off and the triage router sees the chest pain, flags it as a red flag symptom, and routes the patient to immediate nurse triage, naming the exact reason. Each agent's real response streams in, and the chat history shows the cost of the whole run. Careful, private, and fast. Exactly what intake has to be. With the team tested, it's time to put it to work. Saving the flow publishes it under one agent code, and the whole team can meet patients wherever they arrive. The first way is an embeddable chat widget on the clinic's patient portal. Someone who isn't feeling well can describe their symptoms at any hour, and behind that one chat box, the intake agent records everything safely, while the triage router decides how urgently they need to be seen. So a patient with serious symptoms is flagged for immediate attention instead of waiting in a queue. Fast for the patient and private by design. Clinics also have staff answering calls and messages, so the second way is Chat Assist, our live agent co-pilot. Here an intake coordinator is helping a patient. When the patient describes their symptoms, the coordinator hands it to the assistant, which runs this very same two-agent team, recording the intake and running the triage check, and drafts the reply. The coordinator reviews it, adds a calm, reassuring word, and sends it. The agents do the careful work. The human provides the human touch. And there's a third way for a patient to reach this team, the phone. Because these are AI-MCP agents, the same intake and triage duo can connect to a standards-based SIP telephony provider and answer real calls, so a patient could simply phone in, describe their symptoms out loud, and have their intake recorded and their urgency assessed by voice. It's all managed here in telephony setup, phone numbers, call history, and diagnostics. One team across the portal, live chat, and the phone. And that's a patient pre-visit intake team, an intake agent that records the visit while automatically protecting private information, a triage router that catches the red flags and decides urgency, joined by a clean handoff and delivered as a self-service widget or a live agent co-pilot, all designed on one canvas without a line of code. Careful where it counts and quick where it matters. Thanks for watching. I'm George Snyder, and I'll see you at the next AI-MCP multi-agent deep dive.